Okay, we're going to start with treating Robert's ankle today. And go ahead and put this one down on the floor for me. We're just going to start with a simple range of motion, kind of see if we can feel where these restrictions are. And he lacks a lot of range of motion in dorsiflexion, so that tells us we want to target the top of the ankle here. He also feeling some restriction here on the outside ankle too. We're going to palpate for some tender spots. Does this hurt?
A little tender.
How about through here?
Yeah, a little bit.
Anything along the outside here?
Right there's a good one.
Okay. So that just gives us a good idea of where we're going to start with the machine. Our machine has multiple settings and as well as multiple levels of intensity. So we can turn it higher for those that have a little bit higher pain tolerance and lower for those that need a little bit more of a gentle start to ease into the treatment. Now, Robert did mention that it can be painful as we find some dysfunctional tissue. I don't want that to scare anyone. The pain is more like a productive pain, if that makes sense. So it's going to feel like a dull toothache or something along those lines. It's definitely not anything that's going to send you flying off the table. And then it will dissipate very, very quickly once we get on that spot. So what I like to do is, as I find those painful spots, I'll have the patient tell me, yeah, that's painful. We'll rate it on a scale of 0 to 10. We're shooting for pain that's around a 6, 7, 8. If we find that, then we're going to stay on that area until it dulls down to under a 3, and then we'll move on. So we're going to get started. You ready, Robert?
I'm ready.
Okay. Just start with some gel here. Good. And then I like to start in an area that wasn't super painful, so you know what it's supposed to feel like. And then we work our way to some of those areas that were dysfunctional. So Robert, as I hit a spot that is
right there,
uncomfortable, where would you rank this on a scale of 0 to 10, 0 being no pain and 10 being the worst you've ever had?
I'll rate that as a 5.
5. Okay. So we're just going to hang out here until it goes down to around a 2 or a 3, okay? So let me know once that pain level decreases.
It's already down. It's already down to a 2.
Great. So move over to the next spot. Anything here?
No.
How about through here?
No. Right there a little bit.
Okay. 0 to 10?
4.
How about here?
No.
What about if we angle this way?
Nope. Right there, right there.
Okay, 0 to 10 here?
That's a 6.
6. So once again, we'll hang out here until it goes down to around a 2 or a 3. Robert, let me know whenever that pain level starts to decrease.
It's going down a little bit. It's down to a 5. Still there. Going down slightly, still there though.
So this one's taking a little bit longer, which means that we found the spot.
I say still a 4.
We're getting there
Okay,
though.
now it's got a 3. 2.
Good. And a little bit more here.
Yeah. A 5.
Okay. He's at a 5 out of 10, so we're going to hang out until he gets down to around a 2.
It's already down to 2.
Wonderful. Next spot.
Nope. Nothing.
How about up through here?
Yeah, a little bit. 4. Right there a little bit. Alright, it's gone. Right there.
Same thing.
Yeah, it was a 4, now it's gone.
Check the inside a little. Anything in here?
Not really. Right there. Okay, it's coming. Right there.
Same thing. 0 to 10, where are you at?
I was a 4, now it's a 2.
Wonderful. How's all this through here?
Mild. Ooh, right there.
Okay, we're gonna hang out here for a few seconds.
It's a 7.
7 out of a 10. Let's see if we can get it down to a 2 or a 3. Robert also has some pretty significant bone spurs here on the top of his foot. This machine can work to break some of that up as well, so that's very beneficial too.
Let's go right down to 3.
Wonderful.
Oh, right there, something.
Okay, 0 to 10.
7. That's probably the bone spur.
Yeah, this is most likely where his bone spur is on the top of his foot. He has a really hard time finding shoes that are comfortable because of where it's located. So if we could break that down, it would be a huge help to him. How's it feeling now?
6.
Okay. Still just gonna hang out because he's still up there on the pain scale at a 6.
Let's take down to 5, 4,
Okay, making our way down.
3.
3, perfect. Anything else in this area?
Yeah, a little bit right there.
0 to 10.
5.
5.
Down to 3, 2.
Alrighty.
How many pulses do we do?
So that was just about 2,000 pulses, which is your normal treatment. So you can see it only takes about 5 to 10 minutes. Some injuries do need more pulses than that, and we can add on as needed. So your more chronic injuries probably need a little bit more time. But typically the treatment is anywhere from 5 to 20 minutes. So it's very quick. Like I said earlier, the pain, we can adjust the intensity of the machine if we need to. So don't let that stop you from coming in, because it is short-lived and definitely helps with these issues from a big picture standpoint.
We do more than Shockwave, so some more about exercise, soft tissue.
Yeah, so typically, as well as, we'll do the Shockwave therapy, but also do a little bit of manual therapy to kind of break up some of the tissue and warm it up before we start. And then we'll follow up with some active care exercises that will customize to your injury and send you home to do daily between each of your appointments. We really feel that the compliance with those home exercises helps speed up the healing process and also gives you some tools so that you know what to do going forward in case the injury ever starts to bother you again. You can get right on top of it with those exercises that we've given you. Anything else you want to add?
Nope.
All right.
It already feels looser.
Yeah, let's check out range of motion. You can see he has quite a bit more dorsiflexion, which is great. And definitely feels like we've loosened up a lot of the restriction side to side as well. Wonderful. Alrighty. If you have anything that you're struggling with, please give us a call. We'd love to help you out.